morning, everyone. We'll be starting the annual report 2013-14 webinar presentation momentarily. Welcome. We are currently in Park Royal on Coast Salish territory, Squamish lands, and we'll start with an opening prayer. Is there anyone from the communities who'd like to volunteer? Lydia, would you?
I'd like to volunteer.
Thank you.
We'll just take a moment to be thankful. Creator, Great Spirit, guide and protect us. Keep each heart, spirit, mind, and body healthy, strong, and happy. Creator, Great Spirit, we're thankful for the gift of this day and the gifts we receive every day. Creator, Great Spirit, guide and protect us, our families, our friends, and our communities, all my relations.
Thank you, Lydia. We'll start with a brief round of introductions and then some reflection. My name is Mark Matthew. I'll be facilitating, moderating today's session. I'm an advisor with First Nations Health Authority. My name is Lydia Wheatsum. I'm the chair of the board of directors for the First Nations Health Authority.
My name is Jason Calla. I'm a Squamish Nation member, and I've been serving on the board of directors for about 2.5 years, and I'm currently serving as the treasurer of the First Nations Health Authority.
Good morning, everyone. My name is Tally Baines. I am the chief financial officer of the First Nations Health Authority.
Good morning. My name is Joe Gallagher. I am the CEO of the First Nations Health Authority, and I am from the Tla'amin First Nation.
Doug Kelly, chair of the First Nations Health Council. I'm from Suwali, and I'm the president of the Stala Tribal Council.
Thank you very much. So just in terms of a review, we'll ask our chair and Grand Chief Kelly to provide some reflections. Would also like to open the floor to communities, either via webinar or video conference, to provide their reflections of the 1 year post-transfer. Then we would go over the annual report presentations, and what we'd ask is that you would hold all questions either by video conference or webinar until the conclusion of the presentation, and then we'll have the panel respond to those questions, and hopefully we'll be able to wrap up close to 10 o'clock. So please feel free to participate via webinar, and if we hear you, we'll try and ask people to mute off until we get to the question and answer period at the end of the presentation. So with that, I'd like to invite Lydia to provide some reflections.
Thank you, Mark. I'm just going to start off by acknowledging all of you for joining us and for the good work that you're doing in your communities to work together to support this really important work we're doing. But primarily today, I'm really pleased to present the annual report, and we've had an incredibly exciting and productive year, and it's hard to believe that it's really only been 1 year since we were on the cusp of completing our transfer. We know that we haven't taken this work over because it's easy. It's very challenging, and we've had a number of challenges along the way. But the fact of the matter is those bumps along the way are part of the process moving us forward, where we're actually having an opportunity to have a say in terms of our health services, programs, and budget. The work that we've done now through the First Nations Health Authority, all working together through the transfer, has really created an opportunity and an avenue that didn't exist for our people before when it came to having an influence on the First Nations Inuit health grant budgets, programs, and services, or really a relationship with the provincial regional health authorities. So the work that we're doing is moving us in a direction where we have those opportunities and those access points. Just prior to transfer, years prior to transfer, when I was working in Couch and we were trying to build a relationship with the Vancouver Island Health Authority, there was really no avenues and opportunities for us to connect and have a meaningful opportunity to have influence on programs and services that affect our people and now, post-transfer, we've built those relationships. We've got the connections with each of the health authorities and have that avenue and opportunity to to have a voice in the health services that we're entitled to as citizens in this province. And in terms of of course, the First Nations Inuit Health Branch, for years when they did their work, they developed the programs, they developed the budget, and then when it was all said and done, they put it in front of us and said, here's what we're going to be doing this year. That's the flip side of the work that we're doing now in the direction that we're going in terms of really having that viable, meaningful opportunity to really direct and have a voice in the development of programs, services, and budget for our healthcare. And the partnerships we've developed through the completion of transfer are all contributing to the opportunity for us to take control over our own health and well-being. It is really our work and commitment that as individuals we will take care of ourselves, and also as families and communities and nations will work to take care of each other. There's been so many helping hands and hearts that needed to be committed to get this work done, and it's just an incredible feat to work together to get this work done. Just over the course of this short period since transfer, getting through to 1 year, we've expanded the board of directors. There's been enhancement in regional capacities to support the direction of getting work done and building teams within regions to get the regional work done. We've had the opportunity to make enhancements and health benefits, some early modest changes that will make a difference in terms of helping and supporting our people, like increase in rates and further opportunities as we go forward to look for those transformation opportunities. We've had progress in migrating away from the old Health Canada systems and software, and there's more work to be done there. And we've been able to strengthen the connection between the First Nations Health Authority and First Nations Health Directors Association in terms of providing the support for that part of our, that pillar of our work. So the strength in the process really is that we are working together, and we have the opportunity to now be accountable to each other as we get the work done. And it's a meaningful opportunity, and it's important that we're switching away from a place where we're looking to government to get an answer, and now we're looking to each other, and we're going to be accountable to each other in the work that we do, because our commitment really is to move us forward for stronger, healthy, vibrant First Nations communities.
Thank you, Lydia. I'll ask Chair Doug Kelly to add some comments.
Thanks, Mark. Thanks, Lydia, for starting us off in a good way, offering her prayer. Always mindful that there's a higher power. Always mindful that human beings are blessed with gifts and incredible potential, but also frailties. And sometimes we have to overcome the frailties to achieve the blessings. And so I appreciate the prayer. Happy birthday! Well, a day early. I couldn't wait. It's been a year, less a day. Almost like a jail sentence, eh, Joe? I'm kidding. I was kidding, Joe. Don't look like that. What a year it's been. We started with Gathering Wisdom 6. And I had to ask Joe, I said, 6? Did I miss one? Because all I can remember is the momentum of Gathering Wisdom 4 and Gathering Wisdom 5. Somehow I lost the celebration of Gathering Wisdom 6. And sometimes we need to take a pause and to appreciate how far we've come in such a short period of time. I'm grateful for Lydia serving as our chair, for taking over the reins from Pierre-Luc and providing leadership and supporting us. Jason, for stepping up and taking over for John as the treasurer. 2 very key roles. Once filled by folks that wanted to help, now filled by our folks. And that's what we're doing. My teachers taught me a long time ago that anything that others do for you, you can do better for yourself. And that's what chiefs and leaders said right across the province of British Columbia. Health, we can do a better job if we do it ourselves. And so there are things and challenges and opportunities that face us today. We're now well positioned to begin looking at how we transform that sickness system into a wellness system. We're going to help with things like Step It Up, the newest challenge. We went from beefy chiefs to busy, walking, physically active chiefs. And there are more than 500 citizens, caregivers, health directors, council members, chiefs participating in Step It Up. And so we're beginning to understand that when it comes to our own well-being, there is only one person responsible for our well-being. It begins with me. It begins with you. And so we're all accepting that responsibility. And for those things that we can prevent, diabetes, heart, stroke, cancer, we're going to prevent. And so we're beginning to look at wellness and health in a very different way. That excites me. One citizen at a time. One family at a time. One community at a time. We're going to achieve that vision statement that Lydia referenced in her remarks. That we indeed are going to create healthy, self-determining, vibrant children, families, and communities. We're going to do that work together. The role, the direction has been clear. Keep politics, folks like me, out of our business. And allow our board, Lydia and Jason and their colleagues, and Joe to take care of the business. And they are. Earlier this year, on July 24th, we had an annual general meeting. Lydia and her colleagues on the board brought forward an annual report. They brought forward the annual audit. The members of the First Nations Health Authority are the members of the First Nations Health Council. We have two hats. The work as First Nations Health Council, the chiefs give us a lot of work to do. We can do as much as we're capable of doing, and many of us, we're workaholics. So the chiefs have not been shy about giving us a lot of work to do. However, as members of the First Nations Health Authority, our role is very limited. We, as members, when we're at a duly convened meeting, we can change the name of the society. We can amend the bylaws. We can appoint, and thus disappoint, the board of directors. We can accept an annual report. We can accept an annual audit statement. And we have agreed in our bylaws that together we're going to create an accountability framework, making sure that we're always doing the best to achieve those very high governance standards that our chiefs set for us. So I'm really excited. We're well situated to deal with things like emergency response, fires that threaten the safety and well-being of our community, floods that threaten the safety and well-being of our community, and things like breaches of tailings ponds, which cause a lot of fear in our communities. We're stepping up and we're responding to those kinds of events, and we'll continue to do that work. I want to say that as members, we had a healthy dialogue. We wanted to understand the annual report. We wanted to understand the audit. And we had that dialogue. It was a healthy, respectful dialogue. And that's what we've created, is a healthy, strong organization. I want to close by pointing out that some of us are colorblind. My shirt's not really orange, it's actually red. Those of us that are wearing orange, we're doing so to remember. We're doing so to mark the occasion that Phyllis Jack, who went to residential school, She came, like many of us, from families that were rich with love, rich with family, rich with culture, rich with tradition, but poor in cash. And Phyllis received the gift of a beautiful orange shirt. But when she arrived at the residential school, it was taken away from her. Her prized possession was taken away from her. And that's what she remembers, and that's what the purpose of the orange shirts is, for us to remember what colonial thinking and what assimilation policies did to our children, our families, and our communities. Thank you, Mark.
Thank you, Doug. And I will ask the communities if there's any reflections that they'd like to share 1 year into transfer. Have we added any other video conference sites?
Hi, Chief Sam Perry here.
Hi, Chief Sam.
Yeah, I can't see you guys. Did you guys shrink your picture?
Oh, we went to annual report. Can we get our picture?
The video conference, I can see the PowerPoint right now. You can switch it back.
Yeah, I think he wants to see us.
It was pretty nice, Doug.
Good to hear from you.
Who's all over there to start off with? I see Tom Kelly. He sure slunk.
Lydia Wheatsome from the chair for the board of directors.
Jason Calla, Squamish Nation. I'm serving on the board of directors.
And Callie Baines, I'm the CFO at FNHA.
And Joe Gallagher, the CEO for the FNHA.
Good morning.
And
Morning. Good.
Mark Matthew with the FNHA. So, did you have a comment, Chief, about 1 year since transfer?
Good. Anyone there for capital?
No. We can follow up with you after, though.
Well, I think what we'll do, if we don't have any sites on right now, we'll just jump into the annual report and people can share more during the question and answer period. So, with that, Lydia.
Thank you. Now we're going to take an opportunity to go through the annual report. I'll do a portion of the reporting, then I'll turn over to Jason Calla, the treasurer for the board of directors, to finish off the balance of the report. So the reporting period, the annual report, the reporting period is from April 1, 2013 to March 31st, 2014. So the information that you'll receive in this report is with respect to that period of time. Okay. So we'll work through, it's just a quote from one of the chiefs leading up to and in anticipation of the transfer. So now post-transfer, we'll carry on with the report. What I'm going to do is move through a PowerPoint presentation, and I'll address the priority areas as we move through the report. So the first priority area for the FNHA was transition. So at the through the course of the year, we've met there were a set of success factors, 4 success factors that we met as part of the transfer, including building solid systems and structures, assuming the assets from to the FNHA, taking over the programs and services, and creating a new shared organizational culture. The novation agreements, the completion of the novation agreements in 2009-10 were successful. The transfer of over 200 staff to the FNHA, the completion of the negotiation of all of the sub-agreements that were set out for completion under the approved framework agreement, We also continue to meet and be in compliance with our reporting requirements through this phase. Also, 6 was done, and that was 20 days after transfer, so it was a real load of work for the First Nations Health Authority CEO and staff in terms of getting all of that work done through transfer and then moving through to participating in gathering wisdom. On the next slide, we'll reference priority area number 2, and that area is in governance and decision making. So with respect to governance and decision making, there was work done within the regions, and the regional partnership accords, the accords between the BC health regions and the First Nations caucuses within each region were completed. So there's regional partnership accords. The regions have moved forward in the development of their regional health and wellness plans. The regional directors were hired, one for each region, and the work has, in terms of hub alignment, has been underway through this period as well. There was the body of work that to be done in terms of the secretariat support. So the secretariat support is for the First Nations Health Authority provides secretariat support to the First Nations Health Council to support their work, and also secretariat support to the First Nations Health Directors Association. We had the successful Beefy Chiefs competition or championing exercise that brought so many people to the table thinking about their health, and some were told their stories and some were prompted. The one fellow was like, oh, my wife said I had to do it, and others were like, I've really been waiting for this opportunity. So it was the Beefy Chiefs was a great opportunity to start us all thinking together about our wellness in a way in terms of our physical activity and just movement and how that assists us in our well-being. The expansion of the health directors training. The health directors have delivered 6 training webinars, and that was supported through the First Nations Health Authority Secretariat, and significant engagement on health benefits and the opportunity to look forward to transformation in that area. The next priority area is health services and improvements, and we've got 2 slides on this. There's a lot of work. In terms of health services and improvements, we had there were foundational pre-transfer responsibilities and plans. So from April 2013 to March 2014, doing the preparation for and all of the significant amount of pre-transfer work that needed to be done to prepare us for the phased transfer. And transfer phase 1 was in July 2013, and that was the first part of the transfer where the headquarter functions of health, the regional health branch were transferred. So phase 1, Ottawa, all the work that was being done in Ottawa to support the region, and then phase 2, transfer of the regional functions. So the phase transfer completed in October. And now we're just about 1 year to that date. And then as part of that phase 2 transfer, as I said, the balance of the regional functions and the balance of the work that was under the First Nation, previously under the First Nations Inuit Health Branch. Further, with respect to priority area 3, continuing with health services and improvements, there were regional mental wellness forums held within each region. Mental wellness and substance abuse emerged from each of the regions as a priority area, and so within this reporting period, there were regional sessions held with respect to mental wellness. There was the TRC national event. The First Nations Health Authority was able to support individual citizens in that participation. Panorama implementation has been moving forward. There are more than 28 communities now, community health nurses in 7 First Nations health organizations that collectively provide service to 38 First Nations communities. The 11 health centers have been accredited for the first time in 2014, so setting standards and taking steps to meet them. Priority area number 4 is partnerships. And in this area, the Tripartite Committee on First Nations Health has continued to meet, and that's the tripartite, the First Nations Health Authority, Canada, and the province at the table, as we have a continuing relationship with Canada, even though Health Canada, even though we've transferred and the First Nations Health Authority has taken over what was previously in the hands of Health Canada. We still have to have an ongoing relationship, and so at the Tripartite Committee, it's a high-level opportunity to ensure we're still building and maintaining the relationship with the province and the federal government. The provincial health authorities are represented, as well as the regional caucus members, the First Nations regional caucus members, with the First Nations Health Authority as well at that table, and the First Nations Health Council. The senior executive relationship development, that's the incredible amount of work that needed to be done by Joe and to create the organizational infrastructure and human resources at the executive level to continue to build the organization through transfer. The joint project board is in place, and it's the table where the medical services plan, one of the pieces being dealt with medical services plan premiums, and those resources have been profiled in a way that over the course of 3 years, $5 million a year has been profiled to support the development of services and programs that are community driven by community. The regulatory body and regulatory bodies and the partnership accords. The College of Dental Surgeons is one example where we've had the opportunity to, as the First Nations Health Authority, take steps to ensure that we build those relationships with the interest of ensuring that our people are getting access to quality services. And other agencies and regulatory bodies as well during the course of this period, moving the transfer work forward. The wellness partnership pieces, there were, during this reporting period, 20 events for the inaugural year. So those were opportunities for communities to embrace a day of recognizing the value and importance of wellness and movement and taking care of ourselves. And then I spoke just briefly earlier about the BC Chiefs investment and having the opportunity to really be a bit of a lever at the First Nations Health Authority for our citizens and our communities to take up the challenge of taking better care of ourselves. Priority area number 5, leadership, organizational development, and planning. Under this piece, the establishment of the senior executive team through our CEO, to have a complement of VPs to support our CEO in the incredible amount of work that needed to be done moving through to transfer and post-transfer. Creating an organizational culture of wellness, doing the things we need to do and behaving and using the language we need to use to support that wellness is a key piece for us as individual human beings, as First Nations people, but in terms of our responsibility as an organization. Transfers happened, it was Health Canada, now it's the First Nations Health Authority. There's lots of focus that needs to be done and will continue to need to be done, both from at the board level and through the organization, to remind ourselves that we're not Health Canada anymore. We're the First Nations Health Authority, and it's our opportunity to build a culture of wellness that is driven by the teachings and the culture of our people, and that opportunity we have to work together and care for each other. We're on the road to accreditation, so accreditation really is the standards that are set that we can build our organization and continue to build our organization in a way that we hit those standards, and the result of that is an accreditation exercise that says to the world, if you will, that we've managed to hit those standards and we're operating at a high operational standard. Interim health plan work, the development of the interim health plan. It was a piece that came out of the framework agreement. The First Nations Health Authority had an obligation to ensure that there was interim health plan set out for the FNHA in terms of our operational plans, goals, priorities, services, the evaluation process, and the use of funding per UBC. Significant amount of work, so the opportunity for the First Nations Health Authority in the context of planning to be able to actually do that work and set out interim health plans leading up to a multi-year health plan that will reflect the actual priorities that are emerging from regions and support the large body of work that needs to be done in terms of implementation and the operation of the First Nations Health Authority. At this point in the presentation, we're going to move to some of the financials, and I will please now turn to Jason Calla, the First Nations Health Authority Treasurer, to do that piece.
Thanks, Lydia. We've got 3 slides here to talk about the financial statements of the Health Authority, and I know reading financial statements is not very much fun at the best of times, but really it's pretty exciting to see these financial statements because we're really seeing the transition happen. So I'm excited about it. Not everybody gets excited about these things, but the first slide that you see here is looking at the revenue that the First Nation Health Authority receives. You can see the vast majority of it comes from Health Canada. So $248 million comes from Health Canada. Another way to think about that is about 96 cents out of every dollar comes from Health Canada. We do receive some revenue from the province of British Columbia, about $8.5 million. Another way to think about that is about 3 cents out of every dollar the Health Authority receives from the province. And there is a small amount of funding from other sources that we receive, about $2 million. So that's the revenue side of the picture. The next slide we're going to look at really builds, I think, on what Lydia was talking about when she was talking about priority area 3. And this is the kind of exciting stuff where we see in the first quarter of the fiscal year, we were really in that foundational stage, I guess, or phase of transition where we were building systems to prepare for the transition of functions from Health Canada. In the second phase there, you can see in the middle of the transfer phase, that was when there was some of the functions starting to transition over, and that was the second quarter of last fiscal year. We had some of the health benefits program buyback transferred over, as well as some of the functions that were formerly in Ottawa with Health Canada. They transitioned over to the Health Authority. So you can see the activity ramping up. And the third stage was a year ago tomorrow, I guess. And that's really the last 2 quarters of the fiscal year where we really everything transferred over. So that's the kind of gives you a visual of financially what Lydia was talking about, I think, in priority area 3. We'll go to the last slide here, and this really looks at the various expenditures that the Health Authority has made over the last fiscal year. So you can see there's 2 really big chunks, and that's the health benefits, the First Nation health benefits, which was formerly called, some people might have referred to it before as non-insured health benefits. We don't use that term anymore, we use First Nation health benefits. Another big chunk was contribution agreements, and those were the agreements that Lydia was referring to that were novated, and the Health Authority is now a party to the agreements instead of Health Canada. Those are funds that go to First Nations directly. And we have a number of other categories here, operations, implementation, and other, which includes that includes accommodation, office space, vehicles, the board of directors, personnel, amortization of capital costs, implementation fund costs related to technology, and some transition and migration from Health Canada systems. So that's that $27 million number there on the sort of bottom left side of the pie chart. We have governance and community engagement, which is about $8.6 million, and that's community engagement in the regions. The First Nations Health Directors Association, the First Nation Health Council Secretariats, the regional caucus meetings, and gathering wisdom. The costs for that event are included in governance and community engagement. We have health actions, which is community health action contribution agreements and wellness initiatives. And certainly last but not least, health services, including nursing services, health protection, disease prevention, and health promotion, and environmental public health. So that's a summary, and I haven't read the numbers there. You can see from the size of the slices of the pie, the relative costs that were made last year in those various categories. So I think that brings to a conclusion the financial aspects, and I know the health authority is excited now. We're in a new relationship where we're able to plan into the future, and looking forward to seeing some of the transformation happening in the next few years.
Thank you, Lydia and Jason. And just a reminder for everybody that the annual report with more detailed financials and a lot of other really good information about the work from last year was issued a couple weeks ago, and that it'll be posted to the website this morning. Also a reminder that this presentation and session is being recorded and posted to YouTube, so if you have co-workers or other people interested in the work that are unable to participate today, that they'll have an opportunity to view this later on. So we do have a couple of questions, if there's no more comments from the table. And first we had Lori from OKIB had a question about challenges with people receiving social assistance, and there seems to be a problem with some services being received, and wondering if there was anything planned for, or is there something that we can do as the FNHA to address maybe that disconnect?
I just want to make sure I understand the question. So there's some issues that have emerged around there, people that are on social assistance and they're having challenges getting access?
Yes, it seems to be an access question, no coverage for those receiving social assistance.
I'm not, it's the first time I've heard this issue being raised, and I think having it raised, part of the work we're doing is to be able to assist our people in terms of getting access and breaking down barriers that exist. So if there is a barrier that exists, that somehow people that are receiving social assistance who are already somewhat marginalized are having challenges getting access to service, then we need to turn our minds to it and see what we can do to assist.
Yeah.
There's work that we're doing now with preparing for annual meetings with deputy ministers, both federally and provincially. And so income assistance policy is actually set by the BC government and funded on reserve by the federal government. So we have an opportunity now through our meeting of annual deputy ministers to bring forward those issues. I'm almost wondering though if the question on access is around the First Nations Health Benefits Program, Joe, and maybe you could sort of provide a bit of information about the work we're doing in terms of the early work of transforming the First Nations Health Benefits Program.
Yeah, thanks, Doug. I think actually with this situation, we probably need to have a bit more information. And I would suggest that what I'll do after the meeting is connect with the appropriate regional director to follow up and to develop the specifics on the situation. With the non-insured health benefit program that we've transferred across now as the First Nations Health Benefit Program, that all status Indians have access to that. And so if the individuals that are receiving social assistance, whether they live at home or away from home, are status Indians, they shouldn't be having trouble accessing health benefits. So I think it's good to find out more specifics to see where we should be looking at it in relation to the work that we're doing. But from the health benefit side, if it is that situation, we do have and have created capacity within health benefits for advocacy work, for people to call and connect with somebody when they're having troubles, whether it's getting prescriptions filled or accessing dentists or whatever that might be. So I think it's really helpful for us to do that work on the ground, find out the specifics in terms of this situation, and see how best to address it, which part of the organization, in other words, is involved. Because I think what Grand Chief Kelly is talking about is an important piece of work moving forward from a social determinants and a deputy minister's table. And it may be that there's a bigger issue here if these folks on social assistance are not able to access physicians or other kind of health services. I think a lot of it depends on where they're located, where they're living, and where they're trying to access services. So I think that more detailed review will be helpful.
Thank you. Next we have.
Could we
oh,
hold
sorry.
there for a while?
Yep,
Hello?
go ahead, Chief.
Could we intervene here for a while?
Yes.
Thank you. That last one you just mentioned, a tremendous amount of our members right in that category now, and they're getting one elder is $1,700 for a cataract surgery that he doesn't know why he's paying, and it's been taken. Well, they're taken to small claims court. They're pretty well on hip surgeries or handicap, and social assistance don't cover those anymore. And before we took over, these were paid for by Health Canada. Is there a reason why we can't be doing that and continue that process till we have something more concrete? But right now, it's a day-to-day for our members, and they have this humongous bills in their pockets and they don't know what to do with it, but are forced to pay, especially our elders.
Thank you, Chief. What I'll have done is again some follow-up to make sure we're clear on exactly how it works. I wasn't aware, but I may not know how health benefits might have been covering those kinds of operations in the past. Usually I was assuming they'd be covered through medical service plan premiums, and so we're the group administrator to ensure that all of our people have their medical service plan premiums paid for. So I just need to confirm the kind of procedures that people are needing and getting that they're being charged for, because that really doesn't make a lot of sense. So I will take it upon myself to make sure that we follow up with you directly and get the information from your community and look to understand what that impact is, both on the elders in your community and other elders across the province. So I really appreciate you raising that, and we'll look to have someone connect with you very shortly.
The other thing that Chief Sampera, I had a similar experience with one of my community members who went into hospital. They did not have anything but a private room, so he was put in a private room. He didn't ask for a private room, and then they billed him. They billed him because he was in a private room instead of a room that was shared with others. And so he, like your citizens, didn't have the ability to pay, and so he raised the issue with me, and I brought it up with the Fraser Health Authority, and there was a mistake in the billing codes, and so it was a clerical error by someone in the hospital administration. When it was brought to their attention, they fixed it. And so we need to make sure that we understand where and when these kinds of things are decided and how mistakes are rectified. So I think there's an opportunity, Chief Sampierre, for the Northern Regional Office Director to become aware of those situations and to do some advocacy work in addition to the work that we would be doing around the First Nations Health Benefits Program. Thank you for raising that issue.
Yeah, thank you. I did bring it up at our terrace meeting last month, and I'm talking about what do we do with these people now. They're short a lot of money, and they're pensioners, and we don't cover anything under SA, like getting their wood or paying for any of their heat. And there's one there with $1,700. He paid it out, and now he's got pretty well nothing to live on. And I got another one there at $900, and how can we get these people their dollars back? The one with the $1,700, he was going blind and had to do his cataract surgery on him, and he didn't know what it was all about. So I'm just wondering, what can we do for these people now?
Well, I'll just add a little bit, and I feel bad that these people clearly are under a lot of pressure to take care of their health and have these expenses out of their pocket. I hear you saying that you've raised it in Terrace, but raising it here with our CEO right now, I think what we can do is have a quick follow-up as quickly as possible, as Joe, our CEO, has suggested, so that we can have an answer for our citizens, to get them support and understanding of how they can get access to healthcare services without having those sort of challenges that they can't meet. So, Chief, I'm just suggesting that now that we've raised it, an immediate response would be our CEO we can turn our minds to it and try and address the find a way to address this.
Thank you.
One more question.
One more, okay.
Accreditation, that's a really good one. I'm so glad you guys are going in that way. I know we did our education, and our education went from 30% to 100%.
Wow.
You know, the grades, it's just a big achievement. And are there dollar allocations for this? It's really going to push it here in Kitsilano.
Yeah, we continue to support accreditation in communities, so if your community is interested, we can put you in touch with Greg Shea. So your health director should know Greg Shea, who's a VP of Corporate Services, and he's supporting our work on accreditation at the moment.
So the health, oh, sorry, I'm just going to add that there, just as Joe suggested, there's a budgeted item to support the moving forward the accreditation of the First Nations Health Authority, as well as to support communities.
Oh, good. I got my our health finance personnel here, so she'll be doing some paperwork with you.
Good.
Thank you, Chief.
Thank you.
So we have a couple health benefits questions. Michelle asks why so many prescriptions, supplies, service, dental are not covered by health benefits. So do we have a response from Michelle?
Sure. When we took over a transfer, Jason mentioned it briefly. It's a buyback arrangement. So what that means is that to transfer in the time frame that we had, we were required to buy back the claims processing services from Health Canada, and that has provided for the opportunity to continue providing health benefits, but really in the same form that they were as the non-insured health benefit program under dental and pharmacy. Now, it challenges us at the First Nations Health Authority because as long as we're in buyback, we have to work through a federal framework because that's the framework they've put in place to support the claims processing system and activities. And so what we're doing now is we're working to replace that buyback arrangement with our own claims processing system and solution. And once we get to that point, we can have a look at the kinds of things that are going to be eligible in terms of our formulary when it comes to which prescription drugs will we pay for, and then dental, the kinds of services. But right now we're a little bit limited because of the way that we've had to transfer it across. And so Canada sets its own limits in terms of what they can and can't do, or what they will and will not pay for in relation to both dental and pharmacy. So we'll have the opportunity to make changes once we have our own claims processing, but we will have to have a discussion on what's in our formulary and will there be limits to it, because we still have a set amount of money, and we will be challenged to try and pay for everything that everybody is looking for. So we've got to try and find the best way to make some good decisions so that we can cover those things that are important and find a way to support the health and well-being of our people the best we can.
Thank you. I think that probably covers off a few of the health benefits questions that we've seen. An interesting question on the budget. Will there be more resources allocated for regional engagement and potentially less on gathering wisdom?
Say it again, the question.
More resources allocated to regional engagement and potentially less on gathering wisdom.
I know we have it in, I put my finger on the number, but there, in terms of community, the investments that the First Nations Health Authority has made in terms of community engagement have been really significant, particularly leading through transfer and leading up to transfer, in terms of ensuring that we connect within the regions. Will there be more to regions than gathering wisdom? I think gathering wisdom is an important piece, but at the same time, resources are being profiled to ensure that the regions have budgets to do, and the development work necessary, and the planning and the implementation within regions. So the board of directors has allocated resources to community engagement. And what we're seeing, so we're reporting on this period from 2013 to 2014, what we're seeing is that as we move forward, there's into this the current fiscal period, that there's more hands-on work now that transfers happened in terms of the development within regions, and the board is budgeted appropriately.
I would add, and I appreciate the question, what each of the regions have done now is they've completed a regional health and wellness plan. And in terms of health, we're covered. We're covered in that a community will deliver services. The regional health authority will deliver services. And Joe and his team at the First Nations Health Authority will deliver services. But there's a number of priorities that are beginning to emerge in terms of wellness. And I think there are opportunities that will become available for regional caucuses to do more work depending on what's in their wellness plan. And so we will be doing advocacy work with the BC deputy ministers. We'll be doing advocacy work with the federal deputy ministers. I'm very hopeful that on our priority matters, that we will be able to advocate for more investment in the regions to carry out work on the wellness priorities set by the chiefs in each of the regions.
Sure.
And just a comment from me in terms of regional expenditures for community engagement versus gathering wisdom. The bylaws of the First Nations Health Authority set out that we'll hold the gathering wisdom every 18 months. So we used to do it every year. Now we do it every 18 months. So we have stretched it out to do it less. There is a lot of value in the regional engagement, the regional work, and the sub-regional work right down to the ground. I also though see a lot of value in bringing everyone together provincially to talk about the health plan and our people regardless of where they live in the province. I think that's been very helpful as well for gathering wisdom. And we are taking an approach with gathering wisdom in relation to it being a provincial health forum that will really help provide a lot of benefit for our attendees from the regions in terms of learning opportunities, networking and connections, as well as connecting everyone to maybe the population health aspects of it. And I think an interesting development for us is really taking more of a business approach with it, so that we start finding ways to generate funds to pay for gathering wisdom. So, we've been trying to reduce the cost of gathering wisdom by having a better sponsorship package with industry and health and other partners, so that we're not covering all the costs. So although our forum has grown, our annual or our budget for it, which only comes in every 18 months, so every second year almost, is staying the same, or it's actually getting a little bit less per person, if you will, based on the growth of the event. So we are trying to be more efficient with it, cost efficient, and also it becomes an event where we have an opportunity for many different dialogues to be happening. So I think it is becoming fairly efficient moving forward from a cost point of view, and so that we can maximize our resourcing of the regional processes and not at the expense of gathering wisdom.
Thank you. We actually have a bit of a follow-up question in terms of how the regional allocation was decided. I think that was part of the regional enveloping process.
So the regional envelopes were developed through the work of the Policy Planning Strategic Services Shop, and they looked at a whole number of different approaches in which funding allocations were initially or were set out in different areas through Canada and province and other things, and found that they, by applying those principles generally, they were able to come up with what they thought were the notional amounts. And so the notional amounts have been developed through that kind of practice. Now we're at the stage of looking to see if we can work with the regions to expend the resources that are in the regional envelopes to try and assess those amounts versus demand. And so we're still in that process because the regions are still implementing the processes to fully expend the monies that they've been allocated to this point in time. So that's the process and that's the intent. And once we know, how the regions can work through setting priorities and then making decisions to meet demand or to address demand, we'll know where we sit relative to the initial notional allocations and the approaches we took to determine the initial amounts.
Yeah, so it's early days in terms of a transfer, and the developmental work that Joe's talking about really is a process to develop the regional allocations in a way that is fair. So we do take into consideration a number of elements in the development of that. So just in terms of recognizing that each region has different challenges as well as similar challenges, that the development of their regional budget could reflect those differences as well. So they're not all exactly the same because there's different considerations in each region, but it's done in a way that's fair.
Thank you. So continuing on, we have about 15 minutes left. For those First Nations that are self-governing with direct agreements with Health Canada, how does that impact the resources, regional strategies, and agreements?
The First Nations that are self-governing, they variously within their agreements, whether it's a treaty or legislation or otherwise, they've set out in self-government agreements the direction that they want to go. Depending on the content of their agreement and whether or not they've drawn down health as an area where they will actually fill the field, there's different ways to go forward. So with each First Nation or nations that are self-governing, we've been working with each of the nations to develop what kind of approach they want to take in terms of the exercise through their self-determination, giving the opportunity to work with the First Nations Health Authority and the opportunity to be part of this transformative process. But fundamentally, First Nations that have self-governing agreements, it's up to them in terms of the content of their agreement and the direction they want to go in terms of exercising any or drawing down any of their authority on health. But the First Nations Health Authority is going forward and partnering in whatever ways we can based on the direction of the self-determining communities.
Great, thank you. A data management question. Is there a commitment by First Nations Health Authority to support and enhance data management for communities to better plan for priorities?
Data management is a really important issue for all of us, and so we do support it as a concept across the board, including with communities, and we're trying to make sure that we can do it in a, if you will, a system-wide approach, so that we can figure out the best way to support data management in communities at regional levels or at nation levels, regional levels, and then provincially, because we have an interest in our data and to know how our people are doing regardless of where they live in the province based on the goals and priorities we have set in the plan. So we're trying to work out approaches and solutions at different levels and trying to stay away from independent standalone solutions that are more high maintenance at the end of the day, or that only serve a minimal need, if you will. So it's a big issue, it's a big challenge. Technology is changing all the time, and we have to be careful because we do have limited resources to invest in it. So we're trying to make sure we can put in place a system-wide approach so that at the end of the day, all of our communities have their data, but they can also communicate with others in terms of data and other things.
Great, thank you. We have sort of back to social assistance. Compassion travel is not covered under health benefits, sometimes a big issue for those in social assistance. I think we have some travel updates. I'm not sure where we sit with compassion travel.
I think I wouldn't be surprised if it isn't covered under what we have. We've been moving forward and trying to find a way to look at shortfalls in terms of our medical transportation program. And so the VP of Health Benefits is currently going around and having discussions, visiting some of the sub-regions and some of the caucuses to have these kinds of issues brought forward and identified so we can understand what the issues and needs are across the province. So I would expect that compassion travel will be part of the information needs that he is gathering as he's going around the province as we speak. So At this point in time, I would have to ask specifically how that, fits in relation to the health benefit program. I'd have to ask the VP in particular. But like I say, I think if it is raised as an issue out there, he'll be capturing it.
I understand we have a new video site. Bella, can you hear us?
Yeah, can you hear us?
Yes, we can. Do you have any? Were you able to catch any of the presentation?
We got it, yeah, we had it on computer first and then we got finally hooked up, so we're good.
Okay, perfect. Any questions, comments from your site?
Chief Sanperior, it's a good club. It's too bad we have such a short time, but this interim health plan, I believe, it's something that we need right away. Right now, at a council level, we're doing a new community comprehensive plan. And is there any plans for our health to do the same scenario type of a workshop for our health in developing this comprehensive community plan? I understand Indian Affairs is putting up a 3-day workshop in Victoria next week for the CCP. I think it's something that we should look into for the health. One of the issues we have to identify, and there is our employee health benefits. We have workers here for 20 years now sitting on my table, and they haven't even had the options of they can go for this health benefit plan. I think we should indenture that. And last but not least, provincial revenue, the measly little $8 million. We'll say it again here in the north. We're expecting a great big overturn in developments within the northwest area, and where we're going to have an influx population inside of 5 years to about another 100,000 individuals moving up. The province should be well aware of this for additional health costs.
Okay, well, I can respond to some of your questions, and then we'll see what more we can add to it. With respect to comprehensive community planning and the interim health plan, the health of our communities is an important aspect of our comprehensive community planning, and so the work that we're doing at the First Nations Health Authority to develop the interim health plans reflects, one, it's an obligation we have under the framework agreement. So we've got certain timelines wherein the First Nations Health Authority has to develop and submit the interim health plan. Over time, we've had one interim health plan. We're in our second interim health plan. We are moving towards, in the development of the health plans, a multi-year. It would be a 5-year health plan. So that's a longer-term planning process that we're moving towards. And I think it's important to think of where those opportunities are within communities doing their comprehensive planning to see how they link into the through their regions, through their communities, through their health centers, and through their regions, are contributing to the development of the priorities within the interim health plan. But the interim health plan, as it's developed now by the First Nations Health Authority, is a province-wide piece. And so in addition, within each region, the regions are developing their health plans. And as we develop, moving towards a multi-year health plan, those regional pieces that are being generated, regional priorities and pieces that are being generated, we need to be able to, and the objective is to incorporate and develop this province-wide interim health plan based on contributions and priorities from the regions. So I think it's, when you're talking about going to this other workshop, that it'd be interesting to be able to, in the context of community, comprehensive community planning, how we can use some of the work around regional planning to support First Nations in their community comprehensive planning to make sure that health is part of that plan overall. I was going to just as well comment on the BC money. When we're looking at this reporting period, the money that's on the table from BC, the 8 million, you're right, it's not a lot of money, and at the same time, this was our, and we're, as I said, early days in terms of transfer, and BC has the lion's share in this province of resources that contribute to the overall healthcare system in this province. So part of the exercise we have is through those partnership accords, through the work that we're doing within the regions, to ensure that we're leveraging as much as we can for our citizens, because our First Nation citizens are also citizens entitled to services from the Ministry of Health from the province of British Columbia, and that's the leverage that we need to keep using. So we're also developing the health plans, but building those relationships with the provincial government and the Ministry of Health, wherein it becomes clearer and clearer as we go forward that our First Nation citizens are just as entitled to services from the provincial government as any other citizen. And that may sound straightforward, but in fact, you're probably very well aware that that hasn't been a strong relationship or, on the part of the province. Those are just a couple of comments and questions.
What about our employee health benefits? We've attempted that before the transition. We haven't heard anything about it yet. And we have employees here 20 years and they don't even have a private pension plan or anything to go on. You know, where are we with this? This is one of the first things we identified 3.5 years ago, and we're still not on the table. We gotta respect the reserve level, you know, and give them the benefits that other people are getting out there. That's it.
Yeah, thanks, Chief. I appreciate what you're saying. I think that as we sort of spent the year trying to stabilize this organization, that we're getting to the point to be able to look at how we can support the workforce in our communities. I think that's an important point that you raise, and that the First Nations Health Authority, as a provincial-wide First Nations health organization owned by BC First Nations, potentially can play a role in that area, and we're looking to try and explore that moving forward. So I think it's a really good issue that you've raised, and one that we've got to start addressing to ensure that we can help support and look after the employees that are working on the ground in our communities. So because we're funding them through the agreements, what else can we do? And there's a potential of an economy of scale concept that could work for a lot of communities, where people could, you know, share in a health benefit, employee health benefit program of some sort, as one kind of function that the FNHA can help facilitate somehow. So I appreciate your point, and we are getting around to looking at it. I apologize for the, it does take a bit of time as we're doing a multiple sort of effort on a number of different areas, but I will look to continue that discussion with our board of directors and others on how we might provide a solution. So we'll look to come forward with something in the near future, I hope.
Thank you, Joe. I just want to say that sorry, I don't know if that's my echo or him. I just wanted to say as well that the important thing here is that we're post-transfer, and really we actually have the opportunity now to, going forward, to strategically plan on how we support our workforces out in the communities, as Joe has said. But my point really was that post-transfer, we actually have an opportunity to do that sort of thinking and planning, whereas we didn't have that opportunity under the auspices of Health Canada delivering services.
Okay, I think we have about time for one more question, and then we're going to close it off. We are noting all the questions.
Yeah, just one, you got my address to send my check, eh?
Yeah, I think it's on file. So, and then we'll close it off. We are noting the questions, and there are still several health benefit questions on the line. I really appreciate you bring those thoughts, either yourself or through your health director, to your regional caucus sessions, and work on some of those with John Ma, as Joe mentioned. The last sort of question was about dialysis, and so there's a need for dialysis in the Central Coast communities, and there are those that have to relocate to access service. Wondering if there is any comments from the table around some of that work.
Yeah, I think the need has been identified, and it has been identified in other areas as well. And through our work, you know, with the regional health authorities, I think that it's up to us to come up with some solutions to figure out how to address those issues. Because if it's not available in the community, that it's a challenge and potentially a big issue for us in terms of medical transportation. So it is something, and it's one of several issues, if you will, that we need to address in terms of bringing services closer to home. So it is on the radar, early days as we mentioned, but something that's been talked about. And so I appreciate the question being raised, and one that we'll continue to follow up with the province on in the various regions through the various planning processes. And ideally it's one of the priorities, if you will, that has been brought to the regional table through the regional partnership accord based on the leadership there, so that we can make sure there's a focus on it within the specific regions that are raising these kinds of issues.
Thank you. Thank you, everyone. Chief, would you mind muting your mic there? We can still hear you shuffling a little bit. Thank you. And I'll actually turn it over to Grand Chief Doug Kelly to close us off this afternoon. Thank you, everybody, for your participation.
Thanks, Mark, for chairing our interaction. Thank you, Chief Kitts Gukla, for joining us, and our good friends from Bella Bella for joining us, and any others that are online. Thank you. Thank you, Lydia and Jason, for making yourselves available to present the annual report and the annual audit. We have an exciting year coming, and in the next month or two we'll begin our regional engagement. We'll begin talking about those things that are really important to us. We'll begin exploring how we can continue transforming health services. We'll begin looking at wellness and what are our priorities. Post Mount Poly, I suspect that environment's going to go from number 3 or 4 on our priority list to probably number 1 in every one of our regional health and wellness plans. I'm looking forward to annual meetings of our deputy ministers' tables, both in Victoria with the British Columbia government and in Ottawa with the Government of Canada. We have created through this work a real opportunity to change the world in which we live, to create a better place for our children, a better place for our families, and a better place for our communities. So thank you for your support, your advice, your direction, and your questions. In raising the questions, you give us an opportunity to look at how we can do things better. And so thank you for that. I'll close us with a prayer. You might want to turn your volume down. I'm loud. I can't help it. I'm built that way. I'm designed that way. So you might want to be warned. Turn your volume down. Oh